Hi, this is Dr. David Ginsberg, and the name of this video is Self-Myofascial Release to help warm up for sporting events. So using the foam roller the correct way can help increase blood flow and improve muscle flexibility, which is the purpose of the activity. And we're also going to show how to use the foam roller for sporting activities afterwards. Okay, so here's an example of some different size foam rollers, different density, fit medicine ball, and a stick, which all can be used for self-myofascial release. So starting off to warm up for gymnastics or running or really any sporting event, we're going to start with the back of the legs, and you're going to start just above the ankle, and you want to, with a straight leg, roll back and forth. Keep your core tight so you don't hurt your lower back, and roll about this speed fairly quickly, back and forth, maybe 4 to 5 times. Some of the spots will be sore, but you're not going to spend lots of time on those. We're just trying to increase blood flow. And then you're going to slightly turn the angle of your leg to the outside. And then just barely to the inside. So right now we're focusing on the back of the lower leg. And then we can also do this with 2 legs at the same time. Okay, and again, 4 to 5 minutes. Try to keep the knees straight to the hamstrings. Now you don't want to roll on the back right over joints, so you're going to actually place the foam roll just above the knee joint, and again with a straight leg, roll back and forth onto the hamstring, the back of the leg, and then just the outside of the hamstring very slightly. That's a little too, yeah, that's perfect. Okay, and then just a little bit onto the inside of the hamstring, focusing on the back of the leg, not the inside or the outside. And again, we could do both muscles at the same time, or both legs for the hamstring. And then you could slightly roll to get the inside of one and the outside of the other. Again, you want to tighten your stomach muscles and your core. Keep your back fairly straight if you can as you're rolling. One side at a time on the center. And then what you'll do is for your left side, you're going to go ahead and cross your left leg over your right knee, and you're going to roll to the outside, and this is going to focus on the external hip rotators, or the piriformis muscle. And again, 3 or 4 times, 4 to 5 times quickly, and then go to the other side. This gives you a little bit more, it's more specific points on the muscle. You'll be able to feel it. And if with the fit ball, you can actually roll in between the lower back, down below the hips. There's 2 bones that stick out, and you want to put the ball right between those 2. And just keep it inside there, and you can roll a real tiny circle, but stay inside the bones there. And again, just a minute or 2, and then you want to lift the pressure off and scoot over to the side like we just were, and cross the leg, so left leg over the right. And roll on that piriformis, and you'll feel a lot more point tenderness. This could be done with a tennis ball too, but the medicine balls work the best. For the rest of the back line, place the roller above the 2 bony notches in the back onto the lower back. You want to tighten your stomach. For gymnasts, remain in hollow, keep your stomach tight, and you're going to roll 4 or 5 times onto the lower back. Keep your feet on the ground. It should be a controlled movement, but relatively quickly. And then we're going to slide up onto the upper mid-back. Butt stays off the ground as we do this, so the pressure stays on the upper mid-back. And again, remain with a tight stomach or in hollow 4 or 5 times, rolling all the way up to the shoulders and back. Okay, now we're going to flip over and we're going to do the front line of the body. And with a straight leg to start, you're going to roll back and forth onto the shin. There's actually connective tissue on the shin that wraps around the lower muscles. This will stimulate blood flow into the ankle. And then you're going to turn your legs slightly to the outside and roll. And then slightly to the inside and roll. And again, this can be done with 2 legs on the roller, and with both legs up, you actually get a little bit more pressure on the muscles there. and the knees can bend if you want to do that. Mostly keeping pressure. The other option is to cross one leg over the other. So put one over the other heel. Place the foot down by the ankle and keep the legs straight. There you go. And that puts, you feel a little more pressure when you do that? Okay, very good. So now we've done the front of the lower legs. We're going to stop. We're going to place the roller above the knees. We're going to lay on our stomach. And remember, we're not rolling over the knee joint in the back or the front. You don't want to roll right over the joints. Again, we have to stay in hollow. You need to keep a tight lower back. This is very important. And we're going to roll over the front of the legs, just like we did the back, all the way close to the knee, but not over the patella, and all the way up towards the hip joint, both legs at the same time. Now another option is, if we bend the knee or contract the hamstring, we're going to shut off the muscles in the front, and that will help to relax things a little bit better. If you don't feel yourself loosening up, hold your knees up like that and roll. And then again, we can roll slightly onto the outside of the leg, and that would get part of the inside of the other opposite leg if you're. Okay, so now we've done the back of the body, the front of the body, and we're moving on to the side. We're going to do the side of the lower leg, and this will do one leg at a time. And you want to stay straight sideways. Move your top leg so I can see. Yeah, there you go. Straight to the side. There we go. Stay on your side, and you're rolling the lower leg. And on this one, you can actually roll over the knee, over the side of the knee joint, so you get the IT band. And roll up towards the quad. And if you could actually stay more on your side, so you want to lean back the other direction. Yeah, so you're directly on your side. There you go. Try to keep your upper body in line with your lower body. Good. And then roll. Same thing 4 or 5 times. You could start at the top and work your way down if you want to. Okay, now we're going to move up on the side of the body, rolling the lat and upper arm muscle here. So put the roller onto the rib cage and just move very, very shortly, 1/2 inch at a time. And move the roller up towards your upper arm. And that's good. And now we're going to go ahead and move. So for the inside of the leg, you're going to start with the roller on the inside of your left leg. Your right leg can be on the ground, and this is going to get the groin or the adductors. Stay on your forearms. Again, keep a tight core. And be careful rolling up, because there are some blood vessels as you get closer to the hip. Stay on the side of the leg. And then when you want to switch to the other leg, you're going to get up and you're going to put it on the inside, kneel, turn all the way to the side, relax the leg, and roll the leg onto the side. You're going to do the entire body in about 5 minutes. You want to move relatively quickly over all of the muscles, avoiding the joints of the knee in the back and the front, but it's okay to roll over the side, over the IT band. Later in the day, if you've got muscles that are very tight and very sore, to try to improve the range of motion, you can stay on sore spots a little bit longer, for about 30 to 45 seconds. And the way you do that is, let's say your hamstring is really tight. You grab the foam roller, you start out the same way, rolling, and as you're rolling back and forth relatively quickly, as you notice a sore spot on the hamstring, then you're going to just stay on it. You're going to try to apply pressure. You could lift the other leg up so that you got more weight on it, and you're going to hold it over that spot or roll very, very slowly for 30 to 45 seconds, no more than a minute, because if it's very painful and it's more than a minute, you could actually end up getting bruised, or you might end up perpetuating the tightness in the muscles. So hold it 30 to 45 seconds, and then come off it, roll the whole muscle, and then you can come back to that same sore spot or find another one. So that you want to do later in the day.